What are we planning for 2023? So our latest initiative is really focusing in on this lack of consistent and coherent data sets, this sort of barrier that was identified by patients, researchers, and clinical experts. And to try and break this barrier, SRUK has had the idea of developing a patient registry. Our vision is that SRUK would develop a registry of patients living with scleroderma and Raynaud's. And this registry would take together patient-reported data, clinical data, and they would be anonymized and held within an SRUK patient registry. And the information which could be used to generate evidence, which could allow SRUK to advocate better for patients. It could be used to provide evidence for certain aspects of patient care, or the need for certain services to be provided. And it could form also real-world data, provide real-world data or evidence on how drugs work in patients in terms of how this links to sort of outcomes. The data could also be accessed for research or patients could actually, participating within the registry, could participate in research into certain aspects of scleroderma if they wish to. And also the registry could be important in identifying patients that might be suitable for clinical trials, the most appropriate patients for a particular clinical trial. So it could facilitate the development of new treatments. So a patient registry, SRUK is not unique in having a patient registry. There are other patient registries out there. The Cystic Fibrosis Trust, for example, have a patient registry that's been running for a very long time, about 20 years. The MS Society, they have a patient registry which has been running for about 7 years. And there are other charities out there that run registries under various different models. So it's something that we've developed a plan for its development and how we could implement a registry. And we're going to be reaching out to our community over the coming months to really sort of get their views on data and assess its feasibility and whether people would actually be interested in contributing to a registry.